Hello, good evening, everybody. So, tonight I wanted to bring up a topic that had come up in clinic today. Sorry, trying to get my camera to stay still here. Oops. All right, work on that later. So, the thing that came up today was the prostate. So, prostate and prostate cancer is something that many gentlemen are concerned about, and especially in the terms of preventing it and not getting it, or in terms of screening for it. So the prostate is unfortunately a organ that is very necessary for a man's health, high rush, and unfortunately it is something that is very much triggered by a lot of the foods that people are eating. Because it is a hormone sensitive gland, basically certain foods that are common in the Western diet, unfortunately, very commonly will trigger it and can potentially cause it to stimulate its growth and to either grow and cause blockages. For example, enlarged prostate, usually known as benign hypertrophic, can't talk tonight, hypertrophy, or BPH, prostatic hypertrophy. In other words, the prostate itself gets larger. And one of the main ways in which the common dairy products tend to trigger the growth of the prostate is because it has receptors that actually bind to dairy products. So if a gentleman has excessive estrogen intake, either in the form of dairy and particularly, or sometimes some of the hormones that go along with the meat products can influence it as well, then basically that receptor is just sitting there and waiting for the hormones to bind to it and then turn the on switch, and then it does all sorts of stuff down the inside the cell that causes that prostate to grow. Similarly, if a gentleman is overweight, we used to think that the excess adipose tissue, to have a formal name for it, or extra fat cells, that those cells were just kind of sitting there, not really doing much, just kind of making our pants tight at night and stuff. But when those cells were studied, it was actually found that they also released extra estrogen, which also can bind to those receptors and trigger changes down the line. So a little thing that is a little trick for being able to block some of those receptors so that they're not quite as troublesome is using the soy products, because they have phytoestrogens. We'll get to that in a second, Ash. So basically, as far as the receptors go, if you have a regular estrogen, or for those that are curious, some of the things that are present in beer also stimulate the same estrogen receptor. The hops that's present in beer basically stimulates that receptor just the same way that the regular estrogen does. And so that's one of the reasons why breast and prostate cancer, which have a lot to do with these estrogen receptors and other hormone receptors, tends to be higher in folks that are indulging in the alcohol. Anyway, so if a regular animal estrogen binds like this and binds tightly and is very effective at turning on these problems, well, one of the things that happens with soy is it's a phytoestrogen. It's kind of binds, but it doesn't quite match exactly. And so it ends up kind of blocking off some of those receptors and basically not stimulating them nearly as much. So whenever we talk about things like receptors being stimulated or kind of blocked so they're a little bit protected and kind of stuff, sometimes it has to do a lot with different levels. So in other words, if you have just a little bit of soy, it probably isn't going to be enough to really make a big difference. If you have, if I remember right, I think about 3 to 5 servings of soy. I gotta double check that on Greger's website, but that's like the sweet spot for blocking these receptors and causing protective effects. Whereas if you have a lot of soy, in other words, you just go home and eat soy, like way more than people normally would have in a regular diet, then sometimes there's other things in there that can overstimulate the body as well, just other components to it kind of take over. So it's one of those things that I encourage you to check out nutritionfacts.org and NutritionMD to get the latest updates on exactly where's that sweet spot, in other words, where the best part is. Crystal is asking about, does all this affect the testosterone level, or how does it affect the testosterone levels? That's a good question as well, because basically when a gentleman is suffering from excess adipose tissue, extra weight, and that extra tissue is creating its own estrogen supply. Sometimes the testes yes, I'll put it in the comment section. Sometimes the testes just can't keep up with the extra hormones that are coming in from the fat tissues or that they're being eaten. So think like the dairy and the cheese and stuff like that going in. And by the way, even an organic cow is still a lactating cow and still has estrogen hormones in there. So that's another thing. Also, skim milk tends to have more hormones than the whole fat if you're comparing those two. Anyway, more details on nutritionfacts.org, and that will be in the comments afterwards. Alrighty, so as far as the testosterone level, so maybe the testosterone level is here, but all of a sudden the estrogen level goes up. Well, the balance of things can sometimes get a little bit skewed, and so things like low libido, in other words, not having as much of a sex drive, and feminization a little bit, think like the man boobs kind of thing, sometimes can happen. So there's some other things that can happen as a result. So maybe I'll do a testosterone talk one of these days as well. So back to the prostate health and prostate cancer. So prostate cancer, it's a kind of a big deal for the guys. It's one of the more common forms of cancer that's out there. One of the first things that they taught us about it in medical school, actually, was that they were saying that every gentleman, if they lives long enough, will come down with some prostate cancer at some point. So they did biopsies on guys that died in like their 80s and 90s and past 100. And a lot of times they found little tiny islands, little tiny clusters of prostate cancer cells in these old guys that died of like a heart attack or other stuff. And part of why that happens is that a lot of times the prostate will grow very slowly, or the prostate cancer might grow very, very slowly. And so, hi Gurvinder. And so it's very, very possible that sometimes these things will just be kind of hidden and not actually cause any problems. And that's one of the reasons why the test for prostate cancer, people are familiar with a test called the PSA, or prostate-specific antigen. What does that mean? That's basically, if the prostate is like a little walnut and it starts leaking this PSA out of it because it's swollen or because it's sore, because of an infection or something like that. Well, somebody came up with the idea that we could measure that level in people's blood and get a sense for whether or not they are having cancer in that organ. Well, it sounded like a very good idea until they realized along the way that a guy can have a high PSA and still have cancer, or they could have a low PSA and still have cancer. If the gentleman has an infection, it can cause that hormone to leak out and cause, a lot of panic and such. And if the gentleman has just an enlarged prostate that's a little bit swollen, it can also raise that PSA again. So that particular hormone, the PSA, can be affected by a lot of things. And the goal for screening is essentially you want to find something early so you can make a difference in the outcome. And what they were finding was that there's two kind of main flavors, essentially, of prostate cancer. There's the prostate cancer, which is that really slow growing that takes like forever to turn into anything, if it turns into anything. Those are those 95-year-old guys that they biopsied after they died, and they found little bits of prostate cancer and didn't really do anything. And then there's the kind that's a lot more aggressive, that happens at a younger age, that goes from the prostate like straight to the bones, straight to the lungs, straight to the brain, and these people get very far along very quickly. And how do you suss out which of those two you're dealing with? So what they were finding was they were getting all these PSAs in guys over 50. They were doing the finger wave, or one finger wave, which basically is shorthand for for a rectal exam. And basically, the whole idea of the screening and catch it early and do something and save the life was causing a lot of problems, because people were being diagnosed with prostate cancer that had that really, really slow growing kind. They were getting surgeries. They were getting little tiny radioactive seeds, like placed with needles into the prostate, and it was killing off the prostate, but also killing off the nerves and causing permanent erectile dysfunction, for example. It was also causing lack of control of the anal sphincter, so use your imagination. Basically, they were pooing and peeing on themselves without being able to control it to some degree. And the amount of mental suffering from having a cancer diagnosis was also a huge burden. And so a couple of years ago, the U.S. task force said, now wait a second, we're not actually preventing any cancer deaths with it, because they were finding that the guys that had that really quick growing, terrible version of the cancer, they were not being saved any more frequently. They're still getting that really fulminant form of cancer and full court press and all that. And then the guys that were having this really, really, really slow, not doing too much kind of cancer, well, now these guys basically were having erectile dysfunction. They were having all sorts of problems and pains and things like that really didn't need to happen in the first place. So it's a kind of an interesting balance and dynamic, trying to pick who is it that needs to be screened. So basically all men are at risk for prostate cancer, and that really goes up with age. Less than age 50 is very, very rare, and then over 80 it's much more common. So if you look at ethnicity, just reading off of the up-to-date, which I'll have in the links as well, so they've got some great patient education handouts, and they have a wonderful, by the way, discussion on the risks and benefits of that PSA screening and when to screen for prostate cancer and such. So anyway, the folks that are African American have a tendency to get more aggressive prostate cancers, and so they also develop it more often than the Caucasian or Hispanics as well. And they're also, unfortunately, more likely to die of it than the other categories of ethnicities. And they think that part of that is just that when it sets in, it just has much more tendency to be that strong kind, that takes over. Gentlemen that have a first-degree relative, so first-degree, that means your brother, your father, basically that level of very close to the family. If one of them has a history of prostate cancer, then the risk is much higher. Also, in men who have a mother or sister with breast cancer, much more likely as well. There's certain cancer genes that tend to travel together, and the BRCA gene, or the breast cancer gene, basically is another predictive risk factor. So if someone's got a family member with that BRCA gene, then those folks should be especially mindful to be aware of their prostate and what to do. And even the up-to-date, I love it. It says a diet that's high in animal fat and low in vegetables increases the risk of prostate cancer. Much more on that in a few minutes as well. So talked about the PSA already. The rectal exam, when I first started medical school, they said every man with a anus needs to have a rectal exam. Basically, it was said in a much more crude way than that. I'll just leave that to imagination. But anyway, the digital wave for the prostate exam, that was, gospel in the very beginning. And then the downsides of the prostate exam, we started to notice that. So this is not a prostate, obviously it's my hand, but I don't have a walnut here. And so basically, if this is representing the whole prostate, right, which is way smaller, more like walnut size is what it's supposed to be, and this is the finger going in, well, if you've got a small hand like me, you can only really get to that bottom part of the prostate. And so there's only a tiny amount that you can actually feel. It's hard to get up and around and over and all over the place in there. So basically, whenever you're doing the prostate exam, you're only getting a little kind of bit of it. There could be like a hard nodular lump like up in here that I just would never know about because you can't reach it. I mean, it is useful in a way to tell if a gentleman has a prostate infection, for example, which is another thing that can cause that PSA hormone to go way up, is if there's infection. Because if it's, it should be nice and firm. If it's squishy and spongy and painful, then you give some antibiotics usually and treats it, makes it much better. Other things is you can kind of get a sense for how large it is or so. And a lot of times the details of that I'll leave to our friendly urologists, and usually that's when a gentleman's been having trouble for a while. There's all sorts of things they can do surgically to help with relieving issues in this area. Sometimes with medications, if a gentleman's having trouble with his urine, they can do things that will shrink the prostate, which is another reason that in certain populations, like if a gentleman's getting certain prostate shrinking medications, because they influence the hormones in that area, they like to have a baseline PSA before and after and at regular intervals with certain medications as well. Biopsies can be done. They basically, it's all different kinds of ways for screening. So I do recommend that the gentlemen that are concerned about the risk for prostate cancer go ahead and read through the pluses and the minuses of the PSA test and other screening factors. If someone is having a symptom, let's say dribbling urine, unable to start or stop the flow of urine, hesitancy or blockage, like your bladder is really full but you really can't get that urine out. Now we've gone beyond like screening, which is for people generally that don't have much screening, and more into diagnosis, trying to figure out what is causing it. So that's a whole different camp as well. So basically, things that gentlemen can do to help reduce the risk of cancer, moderate exercise. So basically, having an exercise routine is very helpful in general, not just for prostate cancer, but pretty much all different kinds of cancers. Similarly, avoiding tobacco is it's like one of the queen things that you can do for preventing all sorts of cancers. People think of it in terms of like lung cancer, but it is so carcinogenic. You get all those chemicals coursing through the whole body. It increases the risk for bladder cancer, skin cancer, lung cancer, and pretty much everything. So highly recommend staying away from tobacco. Plus, it causes heart attacks and strokes and erectile dysfunction, all sorts of not fun things, so stay away from the tobacco. Similarly, alcohol. So sometimes people think, oh, I'll just have a drink a day or 2 drinks a day, which is moderate alcohol use. The trouble with that in terms of cancer is some recent studies were showing that even a little bit of alcohol, especially if it's done on a regular basis, really does increase the risk for cancers of all types. I think that measured like 14 different cancers that were raised up. That study came out just this last summer, I believe. Alrighty, so I'm going to step away from that and go on to I'm cheating a little bit with my thing. So next I'm moving on to a little bit of information from nutritionfacts.org. And again, these will be in your references at the bottom of the article once we finish the talk tonight. So just again, it's very common, second leading cause of cancer death in gentlemen. And again, talking about moderate exercise, and basically the more plant-based a gentleman's diet is in general, the less likely to get cancers in general, and especially that of the prostate. Whenever I meet gentlemen, especially in the beginning, I usually try to encourage them to stay away from dairy in particular, because of that estrogen binding onto the receptors. If you drip milk and dairy products onto a petri dish full of prostate cancer cells, you can actually stimulate those cells to grow in the petri dish. And similarly, guys that have more animal products in general tend to have higher prostate cancer levels. Other things that are related is total meat consumption. Again, there's a lot of reasons why the meat's carcinogenic. It has to do with the type of iron that's in there. When you brown it or cook it, that process releases carcinogens in general. And there's a lot of different kinds of things that go along with it. Also, deep fried food is also carcinogenic. So basically, the more saturated fat that a gentleman is eating tends to be more troublesome, not just in terms of heart disease or stroke risk, but also the cancer risk as well. Egg consumption. That's something that people didn't know as much about until just a few years ago. And there's a processing that happens. So when you eat eggs, basically there's some gut bacteria that break parts of that egg down into choline. So choline is this compound that comes out of the breakdown products of the egg. And when the gut bacteria munches on that choline, it transforms it into a cancer and heart attack causing chemical, TMAO. Name doesn't matter, but basically eggs are bad news. They raise the risk of diabetes and prostate cancer and other cancers as well. So multivitamins, that's another one that surprises people a lot. The culture is so strongly tuned to, well, just eat like junk and then take a multivitamin to make up for it, just in case you miss like a vitamin or nutrient or something like that. But as far as the prostate or breast goes, multivitamin use is associated with an increased risk of prostate and breast cancer both. So more details if you want to check that link out later as well. Other things that can be useful as well as, again, avoiding cooked meat carcinogens, dioxins, alkyl phenols, just other things that tend to, those are like more industrial pollutants that tend to accumulate. They get stuck in the animal tissues, and then when we eat them, they get stuck in our tissues and can cause troubles as well. So there's a lot of different reasons that the animal products tend to contribute to the cancer risk. So there's a gentleman named Dr. Ornish who did some wonderful research on a whole food plant-based diet with no added oils, and so very, very low in fat, in other words. And also basically what he did was, not only was he studying it in terms of its ability to research heart disease reversal, but they took some of these gentlemen that had prostate issues and they biopsied them at the beginning of the study. And then after some number of weeks and months, they did another biopsy, and they found that the prostate cancer that was starting to form, the early stages, they were able to reverse it, which is pretty amazing for what it's worth. So I encourage you to check out Dr. Dean Ornish's work as well. So he is a very, very thorough researcher as well. And I love Dr. Greger. He's more going in the library and pulling out all the research articles that have been published. Whereas Dr. Ornish, of course, he does some of that too, but he also does the raw research, like the direct in the lab, medical research as well. So kudos to both of them, of course. So basically, even when gentlemen have active prostate cancer or enlarged prostate, the BPH, the more they get to a fully plant-based diet, the greater the ability of the body to reduce and shrink the prostate and heal it up is improved. And even if they change the ratio of plants and animals, it's not as strong as impact, but it can have an impact on helping that prostate to shrink down. And again, one of the reasons is that by embracing the plants, basically the hormone levels overall tend to go down. So back to the soy, soy consumption, try to keep it less than 7 servings a day, which is a lot of soy for anybody that's familiar with it. Because when you have like 7, 8, 9, 10 or more servings of soy, basically it raises some of these insulin-like growth factors. So basically that's a growth hormone that can trigger cancer growth as well, or is associated with it. So what else can you do? There's particular animal products that when we eat them, they also trigger cancer, specifically TOR enzyme. And throwing out acronyms are really, the details don't matter. I gave you the basics of it. So what foods are particularly helpful for suppressing the growth of the prostate? Phytates. Where do you find a phytate? Those are in your beans, your legumes, so that's your kidney beans, your chickpeas, all kinds of beans. Grains, so whole grains, those are very good as well. Nuts and seeds. I have with me, for demonstration purposes, some flaxseed. This stuff is especially good for the prostate and also good for breast cancer prevention. I think I'm getting more props coming in just a second by my system. So beans, grains, nuts, seeds are especially rich in those phytates and seem to be associated with lower cancer risk. So just for a demonstration, these are some good old black beans. And by way of nuts, walnuts are a very good source of things as well, because walnuts are very rich in omega-3 fatty acids as well. So those can be helpful. There are some other things that were helpful with reducing the risk of cancers in general. And one of those is our humble broccoli. Broccoli is one of the most broadest useful vegetables that's out there. Not only is it good for helping to reduce cancers in general, but also can be helpful for detoxing the liver, which basically accumulates a ton of things that it has to process. We're in a very contaminated world, and this little guy here is very helpful for that. So the cruciferous vegetable family, so cruciferous veggies, so that's your broccoli, that's also kale and Brussels sprouts and those kinds of foods as well. So allium families, that is your garlic. So garlic is also wonderfully anti-cancer as well, so a good thing to include frequently. And then specific foods and fruits and vegetables and beverages were associated in various studies of one time or another to be associated with slowing down the growth of prostate cancer. So I'll go through this list slowly. Again, this is found on nutritionfacts.org. So apple peels. So your mama was right. You should eat the apple peel if you can. And of course, washing to get the pesticides and things off of it. Broccoli we just mentioned. Chamomile tea. So here's an example of some chamomile. Chamomile tea is very anti-inflammatory too, so it's a wonderful thing to have around. Coffee. Coffee is helpful for this. If you have a lot of heartburn, maybe not so much. And some people with arthritis, not so much. But for a lot of folks, coffee is actually one of the most common ways in which Americans tend to get their antioxidants, is because it's such a popular beverage. But it does have some potentially anti-cancer effects on the prostate as well. Cranberries. So cranberries are a very lovely food. If you throw a bunch of sugar and stuff on them, it does seem to take away a little bit of the effects. But there is something about the whole cranberries that tends to be globally anti-cancer as well. So a lot of neat research is being done on cranberries. Fenugreek seeds. Fenugreek seeds are also helpful for muscle strength and some other properties as well. The flax seeds, I've already gone over flax seeds. Licorice, that's another one that we can investigate. Bell peppers. I had a bell pepper that was orange, but I'm sorry I ate it this weekend, so I don't have it for demonstration purposes. But orange bell peppers in particular, and of note, the red ones tend to be highest in beta-carotene and vitamin C and such. So orange and red bell peppers are very good for you. Rye bread, it also has some lignans similar to the flax seeds. But the flax seeds are actually much more stronger at suppressing the hormones with it. And then turmeric. Turmeric is another generic, overall very good for preventing and fighting cancers of pretty much almost every body part. So not only the prostate, but also the colon, and very, very good for arthritis and autoimmune diseases. So turmeric seems to be one of those just another powerhouse spice that's just good for overall health. Very good for preventing Alzheimer's as well. And then, oops, I got some demonstration turmeric coming up. Ask and you shall receive. Ta-da! Turmeric. And I just mean the generic grocery store or Amazon or wherever you feel like getting your turmeric from. Sometimes people don't like the taste of it. I can tell you that the more you have of it, the more the taste buds kind of adapt to it, and then if you turn everything just a little bit yellow, it's kind of a good thing. If you happen to have kidney stones, then I would say probably not as much turmeric as folks that have not had kidney stones. So my general recommendation for turmeric is at least a quarter teaspoon a day. If you happen to have inflammatory arthritis, then a quarter teaspoon 2 times a day or 3 times a day, depending on what severity of issues you want to control with it. And then again, there's been a lot of studies on lycopene, which is found in tomatoes, and watermelon is generally being helpful for the prostate as well. So, and then if a gentleman has had prostate cancer and has gone through the surgery or done other treatments to help it, and by no means am I saying just go off of fruits and veggies and ignore the doctors. Please, 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 as always, talk to your individual doctor and follow their recommendations. These are just food for thought, so to say, or things you can do in addition to on your own. But basically, they're saying the guys that decrease their level of saturated fat that they're eating were able to be cancer-free for much longer than the folks that returned to their diet pattern that had predisposed them to the cancer in the first place. Alrighty, and I did have a couple more things to talk about with regards to this. I guess I didn't really talk about symptoms actually, so this is nice having the cheat sheets on hand. Looking over at nutritionmd.org, it's got a wonderful series of articles on the prostate cancer as well. So how does a guy know that he might have prostate cancer? I kind of alluded to it a little bit as well earlier, and that was difficult urination, painful urination, having to go very frequently. Guys don't tend to get urinary tract infections unless their prostate's enlarged, or if they're having a sexual liaison. That usually that's chlamydia, that's a different story. But actually regular old urinary tract infections, guys tend to not get those as often as women do, and blood in the urine. That can be another thing to look for as well. Sometimes if it's hidden, sometimes if it's hidden stuff, then they don't know that it's happening. They can actually come in with metastatic symptoms. So in other words, fatigue and weight loss, fevers, back pain, because the prostate is very close to the lower spine. And I remember one of my doctors in residency telling me about a case that he had personally witnessed where it was back pain, back pain, back pain. Nothing was working for the guy's back pain. And they did an x-ray, they did an MRI, and they found lesions. Like, he was coming in and complaining about essentially metastatic prostate cancer. And fortunately for him, it was caught, and treatment ensued and all that good stuff. But sometimes you got to think a little bit outside the box. So if things are not acting right, there could be something bigger going on with it. And occasionally just no symptoms at all, which is like those guys that die in their 90s of some other completely different thing, and turned out that they had a little bit in there. We talked about the genetics and treatment options. Let's see, I think that was pretty much it. There's a lot of overlap on these websites because the information is very similar. So low fat, high fiber diets actually help as well. So again, that's different kinds of things that go along with it. Talked about the watermelons and tomatoes. Oh yeah, pink grapefruit has lycopene as well, so that's the other one that may be just fun to have on a sometimes basis, and watch out for the alcohol. All right. Anyway, I think I've covered pretty much everything to go with the prostate tonight. So, gentlemen, stay healthy, wealthy, and well, and encourage you to eat your fruits and vegetables and step away from the meat and eggs and dairy as much as you're able to. And if you're able to completely, they make it very easy with some of the websites, like the Dr. Ornish's website, Dr. Barnard's nutritionmd.org. And if you want to know the science behind it all, Dr. Greger is a powerhouse with all the latest, greatest, shiniest, newest research, and the oldest research, because unfortunately a lot of this stuff has been published for forever, sometimes 40, 50 years, and it just never makes it out of the research library and into people's homes. So anyway, hopefully some of the ideas in this video will be helpful for you guys to keep those prostates healthy forever. And thank you, Raj. And it's true. There are actually a lot more physicians that are learning about and sharing some of this information as well. So there's a wonderful conference every fall that a few of us come together and get to commiserate with the other docs that have learned about the power of food and keeping us well, or the power of food and slowly poisoning the population and making people not feel good or more likely to be sick. Okay. All right. Thanks, y'all. And we'll see you next week. Okay. Bye-bye.